Well, scheduling a doctor's appointment during the pandemic might be stressful for some not sure about doing it in person. Well, that's why a virtual option is quick, easy, and a perfect choice for those who just aren't ready to venture outside yet. Here to talk with us about all the options out there is Dr. Glenn Brothers, a family medicine physician with Bon Secours. Doctor, thanks so much for joining us this morning.
Thank you.
Now, we know a lot of folks have been kind of talking about the options that have been out there. We know months ago, we talked a lot about virtual doctor visits when the pandemic first started. Are virtual visits still a good option today?
Yes, they're a great option. And Bon Secours offers multiple different platforms. So we're able to accommodate everything from an email-based visit to a fully interactive visit with audio and video. So this is a great option because you're able to interact with your provider without leaving the comfort and safety of your own home.
Well, now, let's say we're somebody, we're feeling sick, might think that we might have COVID. Is a virtual visit a good option if that's how we're feeling?
Yeah, definitely it is a very good option. So through a virtual visit, your provider can actually assess you and can evaluate your condition and actually give you further instructions or recommendations on whether you actually need to get tested or not.
Yeah, and I know there's some concerns for folks who don't have COVID, but they might feel sick, maybe a different illness, and they don't want to venture out because of fear of contracting COVID. Can they still do the virtual option in that regard too?
Definitely. Again, virtual visits are always a great first option for non-emergent complaints or symptoms. Again, your provider can assess you, evaluate your medical condition, and then based on that can make clearer recommendations as far as potential treatment or whether you actually require further intervention and evaluation.
Yeah, and that could be kind of the deciding factor there for folks kind of trying to judge just how, I guess, immediate of an emergency their sickness or injury might be. Let's say there's someone with a broken bone or a child with a very high fever. Is it still okay for them to venture to the ER or urgent care?
Definitely. ER is always open to help treat medical emergencies. Urgent cares are also a great option, but it's best to call ahead rather than walk in right now, as the pandemic may have some of these locations operating slightly differently than they have previously.
Yeah, that's a great note right there, making sure that we call ahead. Typically in emergency situations, we just show up, but this way kind of give them a heads up. One last question. We know the pandemic has changed a lot of our lives in many different ways. What are some of the biggest changes you've been seeing in healthcare?
Well, obviously in our local market, the pandemic has sped up the deployment of virtual medicine, which again is a huge advantage to patients. One of the biggest challenges during the pandemic has been that people are really more fearful of going to an urgent care or a physician's office where they know that they might be around people who are sick. So virtual health is a great way to get around that. It's allowing you access to your provider in a very safe and more convenient way.
Yeah, it's wonderful to have that option now. I feel as though we've almost kind of been introduced to this virtual screening almost forcefully with the pandemic, but that's kind of shown the innovation that the healthcare industry has been able to enjoy during this time. Dr. Glenn Brothers, thank you so much for joining us this morning.
Thank you so much.